Every month we look at the CASPER report and see where we are, and that fall rate with injury was an area where we were well over the federal and state level, where in other areas we were under. So we knew, for the sake of the patients, we really needed to zero in on that area.
We really did focus on resident-centered care and involving the frontline staff. That was important. So often management groups or we make the changes and we train the staff. Well, what we found out was that there was a lot of input that the nursing assistant had in helping us to identify a root cause of why we were having so many falls. We focused on ensuring that they were a part of the investigative process as well as a part of the development of the interventions.
And it's involving frontline staff in get to the bottom of it. Don't assume you have the solution to the challenge, but keep going deeper and deeper with the why, till you could really get to the root of what is the problem, and then with the help of the patient, the family, and with your coworkers, let's solve the problem and then get a system in place so we don't go down that rabbit hole again. Ultimately, we took the statistics of information, sat down with the nurse aides and talked to them about particular times of the day that their patient would fall in their area, and eventually posted information in our employees lounge where the nurse aides would be able to come in the morning, say, these are the patients in my section, this person has a tendency to fall at 3 o'clock during the day. Therefore, I need to go into the room and to be sure that they're safe, I need to watch them. And as a result of that, our injuries dropped to less than half. Our falls dropped to less than half.
We also involved family members. It was important that if we could, we interviewed them, what worked in the past with your family member. They have a lot of information that we often don't realize is very applicable to patient safety and fall prevention. With the QAPI process, one of the great things about it is that it strongly encourages you to involve the staff that has the direct ability to make the changes and sustain the changes.
Change is always difficult, but of all the changes I've had to make, this has been the easiest change with the biggest reward, better customer service.
I think I feel the most proud of the culture change in the staff. I feel the most proud that the nursing assistants and the families are more involved, and we have seen drastic changes in some of the projects that we've put forth because we have included everybody, and that works. That's the key, and it's a wonderful process.